Welcome back to the morning show right here on ETV. And when we talk about safe sex, many people think about condoms and birth control, but it's so much more than that. It's about protecting your health, making informed decisions, and having access to the right information and services. Yet sexual health remains a topic filled with stigma, misinformation, and a lot of unanswered questions. So today we are getting real about it. So joining us is Dr. Rita Bhika from Mary Stopes, who's here to separate the fact from the fiction and help us understand what true sexual health really truly looks like. Dr. Rita, thank you so much for being here this morning.
You're welcome.
Dr. Rita, I think I'll start with that safe sex is often reduced to just use protection, just use condoms or contraceptives. But what can we do beyond being safe?
I think that using protection, just use protection, needs to be a little bit more explained. I think that most people hear the word and it's all in theory. So if you want to start at a level where we're educating our younger generation and then they can pay it forward when they have children, it's about the practicality of it, the choices of it, and it actually starts with an open conversation about the intentions of both people before you can actually go ahead and go into the next step of actually having intercourse.
That's very true. And let's talk about birth control. So there are so many birth control options available, but I do think that the birth control or the contraception isn't used the way that it's supposed to be used.
Yeah.
How can we change that?
Look, there are many myths about birth control, and there's a huge evolution of birth control. So it's different elements. It's generational advice, it's cultural advice, it's social media, it's your peers and your friends. But I do suggest to go to a healthcare professional, find out the options so you inform yourself. Because one thing through my clinical experience for many, many years, the most common thing that has come up for me is birth control that prevents you from having a menstrual cycle. And that is considered to be unnatural, it's considered to be wrong, that there is a psychological element in seeing that, when technically that's just how the birth control works to prevent you from falling pregnant. So it is debunking those myths, and what may work for one generation may not necessarily work for the next generation.
So STIs and HIV is preventable, but there is still a stigma attached to it. And we know, like the last week, Donald Trump also spoke about it, that he will, take the funding away from South Africa. But how do we have this conversation with young people or anyone in this country to get tested regularly?
So I think the problem is that people feel that they have to be obligated to actually publicize their status. Your sexual health and your testing of whatever it may be is a very personal decision. Yes, should you be in a relationship and you want to have a relationship built on trust and open communication, then absolutely. So I think it is personal choice, and for your own well-being, that's where it needs to start. And people tend to follow suit, knowing that you don't necessarily have to get the results, but having done it can motivate the community, your peers around you to do the same for your own benefit. It starts with you, actually.
I spoke about the peers, and I think that a lot of times we all have this conversation, but one conversation that we don't often have too much of, that we should, is consent, because consent usually isn't a yes or a no. It's much more than that. It's much more complicated. So when somebody is in that situation, they don't want to speak because they didn't say no, but it's much more than that. How can we have healthy sexual relationships to also prevent HIV or STIs?
But you've touched on a very important point. So it starts with a healthy relationship. It starts with a foundation of trust and open communication. I think people fall into the trap of being in love and wanting to show physical affirmation of that love. But a conversation before that, yes and no is very important. If you watch all the movies, and did you say no, did you say yes, etc. So social media element is always going to be there. So it is important, but it's so much more than that, because it's a matter of being on the same page, having the correct intentions with the partner that you choose to engage in.
Very true. And adding to that as well, how can we tell couples or people who are together to go test together? I mean, I'm sure that it happens in couples when you meet each other. Then let's go get tested together, because then it's not distrust. We just met each other and we're doing it together. How can we instill that in many more couples?
So it's a partnership. It is a matter of being able to have the other person's well-being in mind and to navigate this together. And it's a shared responsibility. A lot of STIs actually don't show symptoms, so you don't even know that you do have it. And until it gets to a point where you may have had a sexual encounter and somebody phones you up and say they have symptoms, and then you have to go down the line with whomever you may have had a relationship with or a sexual encounter with. So from a prophylactic, preventative point of view, it really does start with you as an individual and the responsibility with your partner to know that everybody is safe across the board before you even engage. Yeah.
This year, especially 2025, it's great to share this really important information from the get-go. And many times people feel that they do not have help because they might just not have heard about it. But we also do know that sexual and reproductive health care isn't there for everyone. But what services do Marie Stopes then give to people in the Gauteng area?
Well, to give you a broader picture, it's not really the Gauteng area only. We have 7 centres across the whole of South Africa.
Wonderful.
We've got Durban, Cape Town, the Eastern Cape, and 3 centres in Gauteng. And then we also have a telemedicine channel, which assists patients or clients, we call them clients, they're not ill, to be assisted if they cannot come to one of our centres. So that reaches very far and wide on a national level. And it doesn't stop at services. It stops at aftercare, being able to come back if you have any issues. And we practice very, very safe practices. So we have termination of unplanned pregnancies for whatever reason. The reason does not matter. We want to assist a patient. We have STI screening, HIV screening, Pap smears, and also family planning, and all the different varieties of family planning so that we can empower people to use the right family planning.
Sexual and reproductive health is such a personal conversation, and it's so personal to the person, but how does it affect a community if it's not done right?
I think that the approach to sexual health is also valuing your own well-being, and it tends to be compartmentalized or considered taboo. But if you go and do a blood pressure, that's very normal to do. So why think about protecting your reproductive system differently or having a different approach to it? It's a holistic approach, because if you are looking after every single aspect of your body, it is actually going to benefit your mental health. You're going to be empowered by having the information about your own body. And you can actually start to have conversations about the fact that if you have this holistic approach, it can actually be motivational for a community to be able to do it. That to destigmatize that idea that it's separate from your other health concerns. And if you do that, then you can be empowered with preventing unplanned pregnancy. If you do choose to be pregnant, you are a healthy pregnant lady, because we have a massive amount of maternal deaths globally that can be prevented just by having information about how to look after yourself when you're pregnant. And it really does start from a community or from a mentor or from a parent or whomever, anybody can actually empower our women to be able to take that step forward and be brave, and people will follow suit.
Yeah, people will follow suit. And just to make that extra step, and like you said, if that worry and wonder is out of your head, then you just give yourself, or you just give the community a better version of yourself then as well.
Absolutely, because we do have to look at the idea of sex and sexual, any sort of sexual activity. It's fluid. Going down generations ago, it wasn't spoken about. But nowadays, it is an open discussion. The definition of sex is very different from what it used to be a few years ago. But I do believe that there's also value in those, shall I call it generational wisdom, because our grandmothers, our great-grandmothers, aunts, etc., there is actually some truths that will bypass all the generations. And it's about self-respect, owning your own body, more than actually the nitty-gritty of what you're actually going to do. So it's a combination of, yes, being empowered with all the new information, but it's also a filter to not believe everything, especially on Dr. Google, our best friend, but also having a physical human being, a conversation with somebody that you can trust, whoever it may be. And the younger that the children are, or the generation is, to be empowered with the correct information. And I think it's also, from what I find, is that it's all theory. So for example, going back to your question about protection, if you're going to go on and on for about 20 minutes with a bunch of high school kids, nobody is really going to pay attention. But if you bring in a practical sort of element to it, to show them, hey guys, this is how you do it. Be careful of this. So this is what it looks like, whether it's a pill, whether it's a condom. And yeah, it may be uncomfortable, but really, we got to push through the uncomfortable conversations.
You're going to have some giggles,
because
but
it's
they're going to listen.
Yes, but they will listen because it's engaging. Having them try it out. Because a lot of people say that if you do expose them, then you're encouraging the sexual behavior. But honestly speaking, better the devil you know, right?
Exactly.
Yeah.
Dr. Rita, this has been such an informative conversation. I've learned lots and I know what to do this year. And thank you so much for the wisdom that you impart on all of us.
You're
and have
welcome.
a wonderful year.
Thank you very much. Thank you for having me.
What an important conversation. Sexual health isn't just about avoiding the risks. It's about empowerment, education, and making choices that protect your well-being as well as the community's well-being. Stay right where you are. I will be chatting to our local hero next on The Morning Show.